As we head into winter, we know that the virus is more likely to spread in colder conditions. People are indoors, and it seems to thrive more in colder conditions as well. But also people from our ONS surveys are dying at home and in care homes. Not so many, thankfully, in care homes at the moment, less than 100 recently, but still very sad. But quite a few at home, and we still don't have full information about that.
If the same groups of people are dying, why are vulnerable people with underlying health conditions not being told to shield? Is that a political decision or a public health decision?
Well, in effect, the number of restrictions that are now in place are, in some places, over and above what was happening with shielding. And that those instructions and the restrictions follow the epidemiology very carefully as to where the greatest risk is. And shielding or having people stay away from everybody for long periods of time also brings its own risks. So this is a very careful balance.
None of the restrictions under our current three-tier system in England are as severe as the full national lockdown was earlier on in the year. Why do we think that less severe public health measures are likely to work now when they didn't before?
The important thing about the restrictions at the moment is that they are tailored to where the severity of transmission of the virus is highest. So that is one reason why there's a difference between now and the first wave. But the other reason is that there are important national aims as to why this is being done this way at this time, which is that it is important to keep children at school. And that didn't happen in the national lockdown in the first wave. And second, it's important as far as possible to keep people in jobs. And the final thing is to try and protect the most vulnerable.
You say that the restrictions are more relaxed now because you want to keep people at school and you want to keep people in jobs. That must mean that there is an acceptable level of deaths. We are at 310 today. Is that an acceptable level of death, or do we need more severe restrictions?
I am not familiar with this term, an acceptable level of death. Every death is a tragedy, and all the time we work to try and reduce deaths and intervene with the best possible, both clinical practice, but also guidance as to how to protect the most vulnerable.
I accept ultimately that these are political decisions, but SAGE has said we need a circuit breaker lockdown. The independent SAGE scientists have all said we need a lockdown now. Is it your personal view that we need a circuit breaker lockdown?
A circuit breaker lockdown has been examined several times, and it is a policy decision as to whether that is implemented.
But what's your medical advice as a public health expert? Would it work?
Well, my advice is that we actually take account every day and every week in the right way, following the data as we see it now. And the interventions that are being offered now, with the option of further local restrictions, are what is advised now. But the important thing behind your question is that we keep an open mind as to what is and isn't working.
No, I mean, my question is not complicated. There's nothing behind it. It's a very simple question. Would a circuit breaker lockdown now work to bring down infections and bring the R rate below 1?
Well, circuit breakers are being implemented in other parts of the UK, so it's very important that we learn from that. But as I say, it's important to keep an open mind and give the interventions that are currently in place, which are restrictive at the level 3 intervention, very restrictive on people's lives.
Yvonne Doyle, thank you very much indeed. Well, to respond to that, I'm joined now by Professor Liam Smeeth, a clinical epidemiologist at the London School of Hygiene and Tropical Medicine. He's also a GP. Do you think we have the clarity of message we need in this country?
I'm not really sure we do. I think there is clearly a balance between economic vitality and personal freedoms and controlling the virus. And I think it's wrong to set those up as in opposition to each other. Everybody wants to control this virus so that we can open up society again, allow people normal social lives and get the economy moving. And there's a false dichotomy that it's the kind of scientists against the people who are protecting the economy or protecting people's social lives. The only reason the scientists are pushing almost universally now for a national circuit break is so that we can get society moving again more quickly and get the economy moving again more quickly.
A lot of people are confused. If we've learned so much about this virus and we've improved people's life chances in intensive care, why are the death rates going up and why are we being warned that more people could die than before?
I think it was always going to be difficult in winter. People spend a lot more time indoors. We know viruses circulate more. And so we were expecting it to be bad in winter. We needed to take measures a bit earlier than we've taken them and probably take them a bit harder than we've taken them, because we did always know there was going to be a second peak, and winter traditionally for viral infections, circulating viruses, is going to be a worse time.
What do you think of compliance? I mean, what seems to have happened is we've now got debates going on about what kind of lockdown we need, and we've got lots of different messages coming out. Listen to social media and talk radio and all these places, there's conspiracy theorists left, right and centre. And the public doesn't really know what's true and what's not. It's no wonder the rules aren't being followed.
I think that's right. I think there's a fragmentation of the message. I think people are finding the messages confusing. And what we need to try and regain is this idea that this is a national effort. People need to be united as a country and act together to get on top of this virus. The measures we have that we can use, social distancing, self-isolation, track and trace, these all require sort of the public to buy in and do them to get on top of things. And we really need to get this national unity back together. We're in this together. We can get on top of this virus together, but we all need to act together as a country to do that. And that's the most important message, I think, tonight.
So if you were in charge, what would you do?
I would go for whatever you want to call it, a circuit breaker, a fire break, whatever you want to call it. I think the problem is we've got too much circulating virus. It's at too high a level. And the current measures are essentially holding it at that level. It's not coming down. If anything, it's going up. I think a short, sharp, national circuit break, people would understand there'd be clarity of message, clarity of need. We could get the virus prevalence down to much, much more acceptable levels and hold the virus down at that level through the sort of simpler measures that we could then take after the circuit break. We'd still need some measures to control virus, but we'll be able to control it at the lower level, as opposed to seeing it at the high level we're holding it now and it's spiraling out of control in places. I think we need a national push across the country, a circuit break to get the virus back under control and get it back to a low level.